Hey everyone, welcome back to all my listeners. This is episode 2 in season 18. Today is Wednesday, June 10th, 2026. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, well, it is the second Wednesday of the month, and you know what that means. It's going to feature my newsworthy highlights from the OIG Work Plan updates for the month of May 2026. And in my trusty tip, I'm also going to put another spotlight on the month of May. It is for a very important health awareness month that just passed us by. And of course, we should remember this every single month. And I will talk about that for Stroke Awareness Month. And I'm going to go ahead and close out and round out today's episode with a remarkable quote by Anaïs Nin. All right, you guys, let's get into it. So in today's Newsworthy, the month of May's OIG Work Plan updates. There were a whopping 11 updates made for the OIG Work Plan for the month of May 2026. The first is titled Mississippi's Efforts to Protect Children Missing from Foster Care. Now, this report is expected from the Office of Evaluation and Inspections. When children go missing from foster care, they may experience serious negative consequences, including a heightened risk of human trafficking, as well as poorer outcomes related to health, safety, education, employment, and subsequent criminal justice system involvement. This study will review the foster care case files of children who went missing from Mississippi foster care. The OIG will examine efforts the state made to identify or reduce the risk of these children going missing. The OIG will look for any common characteristics among the children and for evidence that the state actively attempted to find the children after they went missing. Further still, the OIG will review services the state provided to these children after they returned to foster care. They will evaluate whether the Mississippi foster care system functioned as it should have to protect these children who went missing from foster care. This final report is expected in fiscal year 2028. Now, the second OIG Work Plan update made for the month of May 2026 is titled Medicaid Payments to Terminated Providers. Now, this report is expected from the Office of Evaluation and Inspections. Federal law requires states to terminate fraudulent or abusive providers from their Medicaid programs, including providers that have been terminated by Medicare, another state's Medicaid program, or any children's health insurance program. To identify providers that have been terminated by other programs, CMS requires states to review the data in its Data Exchange, or DEX, system. This study will determine the extent to which providers listed in the DEX as revoked by Medicare or terminated by state Medicaid agencies were associated with Medicaid claims and encounters, as well as the amount of money paid for those claims and encounters. This final report is expected in fiscal year 2028. Now, the third OIG Work Plan update made for the month of May 2026 is titled Audit of ASFR's Oversight of HHS Awarding Agencies' Compliance with Federal Audit Requirements Applicable to For-Profit Grant Recipients. Now, this report is expected from the Office of Audit Services. HHS is the largest grant-making agency in the federal government, awarding $131.6 billion in fiscal year 2025. The portion of this funding that is distributed to for-profit domestic recipients totaled $4.4 billion for fiscal year 2025. For-profit grant recipients that expend HHS funds above specific financial thresholds in a fiscal year must comply with certain audit requirements, including the submission of annual audit reports. OIG prior audit work for profit grant recipients has identified weaknesses with the annual audit report submissions and timely corrective action on audit findings. HHS awarding agencies are responsible for ensuring compliance with these requirements, while the Office of the Assistant Secretary for Financial Resources, the ASFR, is tasked with department-wide oversight of audit compliance. OIG will determine whether ASFR oversaw HHS awarding agencies' compliance with federal audit regulations applicable to for-profit domestic grant recipients. Now, this final report is expected in fiscal year 2028. Now, the fourth OIG Work Plan update made for the month of May 2026 is titled Series Medicare Payments for Spravato. Now, this report is expected from the Office of Audit Services. Spravato is a nasal spray formulation of esketamine, which is a Schedule III controlled substance indicated for adults with treatment-resistant depression or depressive symptoms with major depressive disorder accompanied by acute suicidal thoughts or behaviors. Medicare may cover Spravato under its Medicare or pharmacy benefits. Prior enforcement actions indicate the billing of Spravato may be susceptible to fraud, waste, and abuse. Now, there are two projects in this series. They are titled The Audit of Medicare Payments for Spravato, as well as Data Brief, Medicare Payments for Spravato. This series of reports are both expected in fiscal year 2028. Now, the fifth OIG Work Plan update made for the month of May 2026 is titled CMS's Tracking and Refunds of Deductible and Coinsurance Amounts for Adjusted and Canceled Medicare Parts A and Part B Claims. Now, this report is expected from the Office of Audit Services. Under Medicare, providers, physicians, and suppliers collect the deductible and coinsurance amounts from enrollees or, in some cases, from other entities. Federal requirements mandate that Part A providers refund any incorrectly collected deductible and coinsurance amounts to enrollees or, when applicable, to these other entities. OIG's review will assess whether CMS monitors provider refunds of deductible and coinsurance amounts on adjusted and denied Medicare Part A claims. Additionally, the OIG will examine whether CMS tracks physician and supplier refunds of Medicare Part B deductible and coinsurance amounts for adjusted and denied claims. This final report is expected in fiscal year 2028. Now, the sixth OIG Work Plan update made for the month of May 2026 is titled Oversight of CDC's Public Health Infrastructure Grant Recipients. Now, this report is expected from the Office of Audit Services. The Centers for Disease Control and Prevention, that's our CDC, their Public Health Infrastructure Grant, which is the PHIG, is a 5-year award that, according to the CDC, was designed to be flexible so that health department recipients can invest in the people, the services, and the systems that address their community's most pressing needs. The CDC developed these awards to address gaps in core public health capacity and infrastructure at the state, tribal, territorial, and local levels. From fiscal year 2023 through fiscal year 2025, the CDC awarded PHIG funding to 107 jurisdictions, including all 50 states, 22 cities, 27 counties, and 8 territories, and freely associated states, as well as 3 national partners. As of December 2025, CDC awarded a total of $5 billion in PHIG funding. Using a risk-based approach, the OIG will conduct one or more audits of selected recipients to determine whether they used PHIG funding in accordance with federal and award requirements. This final report is expected in fiscal year 2028. Now, the seventh OIG Work Plan update made for the month of May 2026 is titled Nationwide Medicare Compliance Audit of Home Health Claims Billed with an Institutional Admission Source. Now, this report is expected from the Office of Audit Services. For home health services beginning on or after January 1st, 2020, the Centers for Medicare and Medicaid Services, CMS, implemented a revised case mix adjustment methodology, the Patient-Driven Groupings Model, or the PDGM. Now, the PDGM assigns 30-day periods of care into 432 case mix groups based upon 5 variables, one of which is admission source, which means from the community or from an acute or post-acute care facility, also known as an institutional admission source. Now, CMS created 2 new occurrence codes, numbers 61 and 62, to allow home health agencies, or HHAs, to indicate that an institutional stay occurred within 14 days of the home health admission. Now, HHA institutional admissions result in higher reimbursement than community admissions, and HHAs may report institutional admissions using these codes even when no corresponding Medicare inpatient claim exists. Prior OIG audits found HHAs incorrectly billed institutional admission using occurrence codes, sometimes based on emergency room visits or observation stays that do not qualify as inpatient stays. So OIG will determine whether home health claims billed with occurrence code 61 or 62 were submitted in accordance with Medicare's source of admission billing and coding requirements. OIG's review will assess documentation supporting admission sources and identify vulnerabilities that allow improper payments. This final report is expected in fiscal year 2028. Now, the 8th OIG Work Plan update made for the month of May 2026 is titled Series Medicaid Managed Care Capitation Payments on Behalf of Incarcerated Enrollees. Now, this report is expected from the Office of Audit Services. States contract with Medicaid managed care organizations to provide specific services to Medicaid enrollees, usually in return for a predetermined periodic payment known as a capitation payment. Sections of the Social Security Act state that federal financial participation is generally not available for services provided to adult inmates of public institutions except when the individual is not in a prison setting and becomes an inpatient in a medical institution. The OIG will determine whether select states made unallowable capitation payments to Medicaid managed care organizations on behalf of individuals incarcerated in state prisons. There are 9 projects in this series, and all 9 projects will be completed in fiscal year 2026. Now, the 9th OIG Work Plan update made for the month of May 2026 is titled Series Medicare Advantage Organizations' Use of Prior Authorization for Post-Acute Care. Now, this report is expected from the Office of Evaluation and Inspections. Medicare Advantage plans must cover at least the same services as original Medicare, but Medicare Advantage organizations, or MAOs, may impose additional administrative requirements, such as requiring prior authorization before certain services can be provided. Prior OIG work found that MAOs sometimes denied prior authorization requests for post-acute care after a qualifying hospital stay, even though the requests met Medicare coverage rules. The OIG will review the extent to which selected MAOs denied requests for post-acute care in long-term acute care hospitals, inpatient rehabilitation facilities, and skilled nursing facilities, and the extent to which denied requests were appealed and overturned. The OIG will also conduct medical record reviews for a sample of cases to determine the extent to which MAOs denied requests for post-acute care admissions that met Medicare coverage rules. Now, there are 3 projects in this series. The active projects in the series total 3. All 3 evaluations are in progress, and final reports are expected in fiscal year 2026. Now, the 10th OIG Work Plan update made for the month of May 2026 is titled Series HHS Consolidated Financial Statement Audit. Now, this report is expected from the Office of Audit Services. The HHS financial statement audit determines whether the annual financial statements present fairly, in all material respects, the financial position of HHS. The financial statement audit is required by the Chief Financial Officers Act of 1990, as amended by the Government Management Reform Act of 1994, and performed in accordance with generally accepted government auditing standards and current Office of Management and Budget guidance, which is titled Audit Requirements for Federal Financial Statements. The OIG will retain an independent external auditor and review the independent auditor's work papers to determine whether the financial statement audit of HHS was conducted in accordance with federal requirements. In addition to overseeing the financial statement audit, OIG will perform related work to assess internal controls, compliance, and other factors affecting the reliability of HHS's financial reporting. Now, there are 3 projects in this series. There is 1 active project currently. There are 2 that have been completed. All 3 projects are expected to complete with reports finalized in fiscal year 2026. Now, the 11th and final OIG Work Plan update made for the month of May 2026 is titled Series Selected Inpatient and Outpatient Billing Requirements. This report is expected from the Office of Audit Services. This review is part of a series of hospital compliance reviews that focus on hospitals with claims that may be at risk for overpayments. Prior OIG reviews and investigations have identified areas at risk for non-compliance with Medicare billing requirements. OIG will review Medicare payments to acute care hospitals to determine hospitals' compliance with selected billing requirements and recommend recovery of overpayments. OIG review will focus on those hospitals with claims that may be at risk for overpayments. There are 33 projects in this series. 19 reports have been published. 14 projects are in progress. Project titles will remain unpublished until projects are complete and reports are posted. All reports are expected to be finalized, and series completion is expected in fiscal year 2026. And now it's time for my best practice tips in Trusty Tip. Stroke Awareness Month was just this past month of May, but any time is a great time to put the spotlight on awareness. I recently wrote an article for the May-June issue of BC Advantage magazine that I want to read some really great Trusty tips from my article. I want to quote for my audience. Quote, Healthcare Awareness Spotlight, May is National Stroke Awareness Month. Stroke Awareness Month is observed every May in the United States. Organizations like the American Stroke Association provide resources and inform individuals to act fast, F-A-S-T, when signs of stroke are visible. F is for face drooping or twisting. Be sure to look closely at the individual's face. Does one side of the face droop or is it numb? Is the person's smile uneven? A is for arm weakness. Be sure to ask the individual about arm weakness because one arm might be weak or numb. One arm could drift downward if you ask the person to raise both arms. S is for speech difficulty. Be sure to listen closely to an individual's speech for slurring or difficulty speaking. T is for time to call 911. Be sure to call 911 immediately if you observe even one of the stroke symptoms that I just stated to anyone, including yourself. There are other signs of stroke symptoms that you should know. These include watching for sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. Be aware of any confusion, difficulty seeing out of one or both eyes, trouble walking, dizziness, loss of balance or coordination, as well as severe headaches with no known cause. Recognizing these signs and taking action as soon as possible makes a difference in outcomes. Higher survival rates versus increased disability rates and death. FAST, F-A-S-T, can achieve strong recovery through early treatment of stroke. Now my article goes on and talks about facts and figures. Fact number 1. Stroke kills brain cells. Stroke happens when a clot or rupture interrupts blood flow to the brain. Without oxygen-rich blood, brain cells die. Fact number 2. There are 3 types of strokes. Ischemic strokes are caused by a clot. Hemorrhagic strokes are caused by a rupture and transient ischemic attack, or TIA. Warning strokes are caused by a temporary blockage. End quote. And finally, I focus a brand new season 18 Spark on fear. So in this week's Spark is a quote from Anaïs Nin. Life shrinks or expands in proportion to one's courage. So very true, right? I love this quote on fear. Have that difficult conversation. Make that career change. Take a creative risk. Be your authentic self. Make your life bigger and better and get out of your own way. Conquer fear. I'm happy Anaïs Nin's spark burns brightly and can still inspire so very many. Well, all right, you guys, that wraps up today's episode. I really hope you guys got a lot out of the month's OIG Work Plan updates, the updates that were made for the month of May. There are a lot of series projects that have been going on quietly in the background, right? And many of those final reports and evaluations will be completed in fiscal year 2026. So I'm definitely looking forward to reviewing all of them when they are published outright by the end of this year, 2026. So really, really informative work that is always provided and conducted by the OIG. So hope you guys got a lot out of that as well. Anyways, you guys, it is getting hot here in the Midwest. I hope you guys are making some time in your weekends to splash in the pool, adventure out to the nearest lake or ocean, wherever you reside. Hopefully you are experiencing some rainfall. I know it's been dry in many, many parts of the country. We don't want any of those California fires or the fires that happen sporadically here in my region. Also, we don't want any of that this particular summer. Hopefully we will all stay safe and sound and just enjoy a nice warm summer. Make the time to take those little small vacations, take those respites, do what you can for yourselves, for your bodies, for your minds, and definitely disconnect from the everyday work. I know that's what I look forward to each and every month. Now that it is 2026, I've been dedicating myself to focusing much more on enriching my life and not just dedicating it to the job and the grind, right? So hope you guys are really taking the time to find other podcasts as well that support that type of energy, right? The energy that you should be reflecting back on yourselves, right? Not just giving it all away to the job and to the workforce, but definitely bring that good, healthy energy back to yourselves and figure out what it is that makes you happy, because you are worth it. All right, you guys, thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.